All right, so just a little bit about our conference session today, and then I'll hand it over to Lynn before I hand it over to our first speaker. But we're going to hear today from, well, it's titled Immigrant Families, Eligibility, Enrollment, and Utilization. And this is actually a session that we like to bring back quite often because it's such an important issue. There are so many families of mixed status immigration that a lot of times don't take advantage of the programs they're eligible for. And a lot of our sisters sometimes need more clarification on who's eligible for what when it comes to our mixed status families. And so our first speaker will be Shelby Gonzalez, who is the Vice President for Immigration Policy at the Center on Budget and Policy Priorities. And she's going to basically share what are the benefits that qualified immigrants versus legally present individuals, what do they qualify for, as well as some common application and eligibility errors that may occur and what some of those solutions may be. And after that, we're going to hear from Karen Yarnes, who is a program manager for MHP Salud. Karen will share other programs and resources that are available to families that have no immigration status, and how to share resources with these families. I'm going to go ahead and advance the slide, and I'm going to hand it over really quickly to Lynn to cover something before we start our presentation. Lynn?
Thank you so much, Sonia. And thanks everybody for being here. I am so excited about this panel and so grateful to Shelby and Karem for your guidance and your expertise and experience with families with mixed immigration statuses and immigrant communities in general. So I just pulled up a couple of these slides to remind folks about some content that we covered yesterday also, just to kind of like tie some of these pieces together, right? We started off the conference yesterday with just a kind of general reminder of all of the different components that are very complex, listed on this screen here, that determine what kinds of health programs and food access programs individuals and families can get into to support their healthy lives. So if you could click one more time, Sonia, then this is the category that we'll be looking at today, but it is one category in this very complicated matrix of other components of life circumstances, right, that determine what kinds of programs people have access to. So if you click one more time, Sonia, we get to this slide also that Ben Davanzo from the National Immigration Legal Center shared yesterday. And this is a document or a slide that really encapsulates some of the qualifications that Shelby will talk about today. So Ben was talking about how DACA recipients have gone from the all immigrants category into the lawfully residing or lawfully present immigrants category, but with a carve out for eligibility for Medicaid and CHIP, right? So I'm just referring back to these slides to remind everybody that all of these categories and components are interrelated. And the reason that we're focusing on immigration related eligibility standards today is because immigrants and immigrant community members are oftentimes in Texas the subject of very targeted rhetoric and policies that are intended to keep them away from accessing public programs. And in the service of equity and in the service of improving health outcomes for everybody in our state, we really want to hone in on this community and the programs that they're eligible for because they help make families healthier, right? And they help contribute to families who can build wealth and be successful and make decisions and do all the things that they want to do. So we just really want to lift up our sister community services to immigrants of all immigration backgrounds, and just again like remind folks that these categories are all interrelated, and immigration status is probably one of the most complex ones in Texas because of all of the policies that all of the policies and really like I think initiatives that are intended to keep immigrants out of programs like Medicaid, like CHIP, like SNAP food benefits, but we want to help people get into those programs, right, when they qualify. And like Kadam is going to talk about at the end of this panel, we want folks to have access to social services and resources, even if they don't qualify for any of these programs. So um, also, just a quick shout out, if anybody was not at our first panel yesterday, we did do an overview of the effects of our Governor Greg Abbott's executive order released last month in August that will require hospitals to start asking community members what their immigration status is when they go to an emergency room or to an acute care facility. So there are a lot of really helpful talking points to share with community members in that webinar as well. All of the recordings from yesterday are on the Zoom events webpage. And I'm going to pop into our chat here also the conference details page, which is where a lot of the resources and links that we've shared over the course of the last couple of days are linked there as well. So thanks for this opportunity to introduce again our two amazing speakers and this really important topic. Yeah, Shelby, take it away. Oh, and there we go.
Hi, everybody. I'm really excited to be here today. I am going to do a very difficult job of trying to explain in a very short amount of time the complex eligibility standards for coverage programs, including Medicaid CHIP and ACA marketplaces, including some very special and complex rules around PTC, premium tax credit eligibility, that are also unique towards people based off of their immigration status, as well as some of the very unique eligibility restrictions and other policies for your state. So I want to start by just thanking all of you for the work that you do. I know that each and every one of you that are you're doing the best you can to really create a pathway to coverage for people in your state, which, by the way, is now my son's home state. And I just really always want to start presentations by letting you know that I know that this is hard work, and I am grateful because I know that making sure that people have access to healthcare is super important, and it is really challenging when you're working with people who are oftentimes restricted from eligibility because of their immigration status. So I'm going to come off camera as I go through a lot of slides. So next slide, please. So first, I'm going to start with talking a little bit about who's eligible for Medicaid and CHIP just based off of their immigration status. And I'm going to start with the overview of the general rules for Medicaid and CHIP, and then we'll break it down to what's a little different in Texas. So first is that we have this kind of definition of what we put in quotation marks, qualified immigration statuses that would qualify people for Medicaid and CHIP. And that includes, it's a very small group, to be honest, when we think about the whole universe of different immigration statuses that are lawfully recognized within our nation. It's a relatively very restrictive group. So first you have lawful permanent residents, also known as green card holders. Then there's a whole list of different statuses that in general are that people get because of humanitarian reasons. So people like refugees and asylees, Cuban Haitian entrants, people paroled into the US for at least 1 year. I'm not going to read all of these statuses to you because as we progress in the presentation, you're going to see a lot of statuses listed, and it grows. It doesn't get smaller. And I really, invite you to think about utilizing these lists that we're providing here, and that we also have resources on the Beyond the Basics website, that is kind of branded down here on my screen. The Center on Budget and Policy Priorities organization that I work for. We have a whole training that goes into depth on lots of topics, and we have resources, including some charts that break down eligibility based on immigration status. So I will not be reading all of the different statuses as we go through, but just to give you a sense that there's a universe of statuses that we often refer to as qualified, that we do refer to as qualified immigrant statuses. That's kind of step one towards eligibility for Medicaid and CHIP. There are a couple of, there's also, they're not qualified immigrants, but they also meet the eligibility standard. They're members of federally recognized Indian tribes or American Indian Indians born in Canada. Next slide, please. So for many people who have a qualified immigration status, they are also subject to a 5-year waiting period. And the 5 years really begins when a person obtains a qualified status and is in the United States. So some people with qualified immigration statuses are not subject to a 5-year bar. And that would include people who have refugee or asylee status or are granted withholding of deportation or removal, people with one of the Cuban Haitian entrant statuses, people with LPR status with 10 years of credits for working in the United States. And when we talk about credits, what we mean is that Social Security Administration, you get credits for the number of years that you work using your Social Security number. There's sometimes opportunities to also get credits for like a spouse's job. In some cases, this is also relevant for parents. The parents work towards eligibility for their children as well when we're talking about credit hours for working. People arriving from Iraq and Afghanistan who have or are in the process of applying for special immigrant visa status, that's usually provided to individuals who have helped the U.S. Army or other armed forces. They help provide services to our nation in that way. Some people from Afghanistan and Ukraine were also granted parole to the United States, and they also are not subject to the 5-year bar when that is the case for them. Some certain survivors of trafficking, people from the Compact of Free Association nations. So there's a group of nations that we have an agreement with, and those individuals, when they're here in the U.S., also are both eligible based off their immigration status as people who have qualified immigration statuses. They are also not subject to the 5-year bar. Qualified immigrants who are U.S. veterans or on active military duty and their spouses and children, and people who have entered the United States before the welfare law that we oftentimes refer to as PERORA. That was on 8/22/1996 when it began to be implemented. That's when we saw a big restriction of eligibility based off of immigration status. So people who physically entered the US before that date and they've remained living in the US also are not subject to the 5-year bar. And then at the state option, children and pregnant people who are lawfully residing in the U.S. Also would not be subject to the 5-year bar. In Texas, that's true for for children, not true for people who are not on the pregnancy side, although you have a different option that I'll mention afterwards. Next slide, please. So Texas kind of takes this groundwork that, this framework of eligibility that is done at the national level, and Texas takes other steps to also further deny eligibility for many people who are immigrants. In fact, it really is most qualified people who meet the qualified immigration standard and who are adults and who entered the country after that, August 22nd, 1996 date that I mentioned earlier. Even if they have met the 5-year bar, they face additional restrictions on eligibility. So, in Texas, the state requires that people also satisfy a work history requirement. So that 40 quarter SSA work credits that I mentioned before, when I mentioned it in the slide prior to this, I mentioned it as people who have satisfied this requirement would not be subject to the 5-year bar. That's the general standard across the country. Texas uses the 40 quarter requirement as like kind of the entry door for people who are immigrants and have a qualified status. So people have to have satisfied a SSA work, 40 credits of SSA work credit requirement before they're eligible for Medicaid, as adults in Texas. And then there's also some limits on eligibility for people who have refugee status, asylee status, people granted withholding of deportation or removal, Cuban Haitian entrants, trafficking survivors, persons granted Iraqi or Afghan special immigrant status, and others. Basically, what Texas does is that they limit how long individuals with all these statuses are eligible for Medicaid, and that limit is 7 years. Next slide, please. On the opposite side, Texas does have some optional coverage for children. So this is where Texas has taken up the state opportunity to provide more coverage. So they were able to expand coverage so that more children um, can get coverage. So in Texas, children have a different eligibility standard than parents. They utilize the lawfully residing state option for children. There is no 5-year wait. There is no work history requirement. That would be weird to have a work history requirement for children, right? But there is also no 5-year waiting requirement. So basically, the lawfully residing standard is a much broader group. It resembles the lawfully present group that is utilized for eligibility purposes in the ACA marketplace. However, that definition is slightly different now than the the lawfully residing and lawfully present standards used to be equal. They used to be the same. Now there are some differences for the reasons that Lynn kind of alluded to earlier, that Ben talked about during his presentation, I believe yesterday, where there was a change when people with DACA status became eligible for ACA marketplaces, and there's a group of other folks too that also began to get eligibility, and I'll go through those in a later slide. The other optional coverage group that Texas has is that for CHIP, they utilize a CHIP prenatal care option that covers people who are pregnant regardless of the person's immigration status. So if they meet the other requirements, they can also get prenatal coverage for for people who during their pregnancy. And next slide, please. So when I mentioned earlier about the lawfully residing program that you have for children, these are all the statuses that would qualify children for the lawfully residing standard. So I'm not going to read all of these to you. I promised you I would not be reading slides to you. But it's worth it to take a look at these slides, because what you first notice is that it's a much larger group than that smaller qualified immigrant group. And in fact, that's the first group that we list here, right? On the left-hand side of this table, we list the people who have that have qualified immigration statuses, and the other folks. And then on the right, we identify additional immigration statuses that would qualify somebody, a child in Texas, for eligibility based off of immigration status. And there's more. On the next slide, you'll see that certain children who are, next slide, please, who are applicants for these statuses would also qualify. So during the application process, a child in the application process with an approved visa petition for lawful permanent resident status, people for special immigrant juvenile visa status, victims of trafficking, the T visa, they are also, as applicants, also eligible for the lawfully residing, under the lawfully residing standard for children in Texas. Statuses on the right hand would include applicants for a lot of different other statuses. So applicants for temporary protected status, for registry applicants, order of supervision, lots of other statuses. It's important to note that applicants for asylum, for the children, they have to wait 180 days. If they're age 14 or under, they have to wait 180 days before they are eligible for the lawfully residing coverage program. So the children, if they're 14 and under, they have to wait 180 days. If they're asylum applicants or they're applicants for withholding of deportation or withholding of removal under the immigration laws or under the Convention Against Torture, um, as well. Okay. If they're over 14, but they're still a child, then they must have a work authorization. So they must have an employment authorization in order to meet the lawfully residing status as children. Next slide, please. So, as I mentioned, and as you heard yesterday, Ben talk about, is that the Department of Homeland Security finalized some changes to the lawfully present eligibility standard that's utilized by ACA marketplaces and the Basic Health Program. And that's going to take place starting November 1. So that's coming up and it's super exciting. And what that will mean is that now people with deferred action for childhood arrivals, who are also referred to as DACA recipients, are no longer going to be barred from ACA marketplace coverage. There are also some simplifications and clarifications in eligibility parameters for statuses already listed in the lawfully present eligibility standards, but there's some really important clarifications that were made under this rule. And as a result of those clarifications, now people who are granted special immigrant juvenile status are also going to be eligible for ACA marketplace coverage. Children under 14 applying for asylum, withholding of removal, or relief under the Convention Against Torture, they no longer have to wait that 180 days. So remember in the prior slide when I was talking about the applicants for these statuses for Texas's children's program under lawfully residing, that they would have to wait the 180 days if they're 14 or under, if they're under 14. That is eliminated for the ACA marketplace. There's no longer a waiting period under the ACA. Okay. Non-immigrant visa holders, there's in the elimination of this language that was previously not in violation of status language, which was kind of confusing to implement. And then people with employment authorization documents. So people, so it kind of eliminates that specification and clarifies that all people with employment authorization documents meet the ACA eligibility standard based off of immigration status, people applying for adjustment to LPR status, and it eliminates that that requirement that they have to have an approved visa petition. So these are all really great changes for ACA marketplace coverage. And like I mentioned beforehand, it used to be that the lawfully residing eligibility standard and the lawfully present eligibility standard were one and the same. That is no longer true. because these changes that we've listed here are not going to be applicable to the lawfully residing standard, okay? That's why I mentioned this is really confusing. It's very complicated. And the best thing to do, in my opinion, is to have access to these kinds of lists and these kind of policies handy as you're working with people so that you have something to refer back to. Next slide, please. So what we did in this slide and then the following slide as well is we basically just now this is all about the lawfully present status. It's going to look extremely similar to the lawfully residing statuses. It now just also encompasses the changes that were made and that I went over in the previous slide. So I'm not going to read these statuses to you, but again, it's so that you have it as a reference point as you're helping people enroll in coverage. Next slide, please. And here, it's some of those, you'll notice if you were to compare this slide to the applicant slides on the lawfully residing slide, you basically would notice that, wow, there's no longer a need for so many footnotes because it was just kind of cleaned up and clarified. So that, now we don't have to have the children that are applying for asylum or applying for withholding and deportation, they no longer have to wait that 180 days. Next slide, please. So important things to think about as you're thinking about this new lawfully present status is that that people that are newly eligible, they are eligible for a special enrollment period, and they could actually begin to get coverage as early as December 1st of this year. You know, you will everybody has a different circumstance and that's a kind of complicated decision for people to make whether or not they want their coverage to begin December 1 or they want to start in the 2025 year. It's a complicated decision, right? Like it wouldn't probably make sense to sign somebody up for a plan that has like a really high deductible for 1 month, right? But maybe it does make sense to sign up somebody for comprehensive coverage if they're already experiencing some medical needs that need to be taken care of, So this is a complicated decision, but just note that that is an option for people to get coverage as soon as December 1. While the change was proposed to also modify Medicaid and CHIP, lawfully residing standard, like I mentioned before, that change has not taken place at this time. So it's just important to keep in mind that now we have two different rules that look very different from each other in terms of who's eligible for lawfully residing versus who's eligible under lawfully present. And then people who meet the lawfully present standard but are ineligible for Medicaid due to their immigration status, they may qualify for premium tax credits even if their income is below the poverty line, 100% of the poverty line. So as you know, in Texas, Texas has not opted to expand the Medicaid program to reach adults up to 138% of the federal poverty line. And for people, that are adults and who otherwise would be eligible for Medicaid, they are in what we call a coverage gap, right? Because the state has not expanded Medicaid. Well, if you are eligible for the marketplace based off of your eligibility your immigration status, so if you have a lawfully present immigration status, but you're ineligible for Medicaid due to your immigration status, you may still qualify for premium tax credits even if your income is below the federal poverty line. So that's important to keep in mind. Because that's a lot of people in Texas. I just want to, and I'll go over that a little bit more in other slides, but I just want to remind everybody that that is a lot of people because Texas has a lot of restrictions based off of immigration status and that we already covered. And then what I would say about for these new folks that are eligible under this new rule is that we can expect that there's going to be bumps in the road. Everything that's new, it's, there's time before you kind of really get systems and processes in place to perfect things. And I would just urge people to like be on the lookout to see if the application isn't working the way that it should. You can reach out to me, by the way, if you see some bumps in the road that you like me to check in with CMS about. I would encourage everybody to fill out the applications as completely and accurately as possible. That might be double checking the numbers that are being input into the documents to make sure that people have the best chance to get their immigration status verified in real time in the ACA marketplace application. Which I keep on referring to as the ACA marketplace, which is known as healthcare.gov for purposes in Texas, right? If a person gets a data matching issue based off of immigration status, I would really recommend like immediately uploading the required documentations as quickly as possible. And then people with immigration related data matching issues may get the wrong PTC eligibility result or may be incorrectly sent to Medicaid. So this is not a new problem, but may happen more for these newer folks. So again, a data matching issue, it kind of happens when you're working with somebody in real time in the application, and for whatever reason, the application healthcare.gov is not able to verify their immigration status in real time. Could happen for income too, but let's focus on it, focusing in on immigration status. Um, when that doesn't happen, that also confuses the application in some ways, and the person might also be told that they're ineligible for the PTCs if the computer thinks that they're in the coverage gap, even though, as I mentioned beforehand, they are not if they're lawfully present, but they're ineligible for Medicaid based off their immigration status. So we'll go into so we went we being the Beyond the Basics program that I mentioned at CBBP, we did some deep dive webinars that talked about this, and you can go onto our website and find that. And we're going to have a webinar on data matching issues next week as well. Next slide, please. So other important eligibility rules for families that include immigrants. So here we go. This is the one that I've mentioned now a couple times, but it's just super worth it to mention it again, especially in Texas, because again, Texas has restricted eligibility for adults based off of immigration status for a lot of adults. So this means that this rule really comes into play for a lot of people. So for the premium tax credit income floor of 100%, that generally is the general rule. It does not apply to people who are lawfully present but are ineligible for Medicaid due to their status, right? So this could be people who don't have a qualified immigration status, even though they have a lawfully present status, like somebody with temporary protected status, for example. Could also be that they have a qualified immigration status, but they're subject to the 5-year bar and they haven't met that 5-year bar. So that could be somebody with a green card or lawful, also known as a lawful permanent resident, but they haven't met the 5-year bar, right? That could also be the case for them. And in Texas, as we talked about earlier, it could be that this is a person with a green card or, otherwise known as lawful permanent residence. They maybe even met the 5-year bar, but they haven't satisfied the 40 quarters of work history requirement that Texas also utilizes in their restrictions on eligibility for Medicaid. That means that group. So the bottom line is that many people who have a lawfully present immigration status and income either in the Medicaid range or below the poverty line are still eligible for premium tax credits or cost sharing reductions. Next slide, please. So, for example, let's take a family example where we have Gina and Adnan, and they're married and they have a son named Sam. And Gina has had her LPR status for 2 years, and Adnan entered the US as a refugee. And Sam has US citizenship and is already covered with Medicaid, so we're not going to worry about Sam's eligibility for this example. So in this example, both Gina and Adnan are full-time college students. They work part-time. Their income is about 90% of the federal poverty line. Next slide, please. So if we are only looking at Gina and Adnan's eligibility based off their immigration status, so let's look at Adnan first. So if is he applying for coverage? Yes. Is he a citizen? No. What's his immigration status? He's a refugee. Is he that a qualified immigrant status? Yes. Is it subject to the 5-year bar? No. Um, satisfied the 5-year bar? He's not subject to it, so it doesn't matter. And then is he lawfully present? Yes. So what that tells us is that he meets the Medicaid requirement based off of immigration status. And the marketplace coverage. And then Gina is applying for coverage. Yes. Is she a US citizen? No. Immigration status is LPR. Um, qualified immigrant, yes. Subject to the 5-year bar, yes. Satisfied the 5-year bar, no. Lawfully residing, lawfully present, yes. So she may qualify for marketplace coverage based off of her immigration status. Next slide, please. So what happens to their eligibility, right? Texas has an expanded Medicaid, so that's you when what in this case. So Adnan has refugee status and income is below 90% of FPL. He's ineligible for Medicaid because Texas is not expanded Medicaid. He's ineligible for PTCs and the marketplace because his income is below the 100% of the federal poverty line. Remember that I also mentioned that Texas restricts eligibility based off of after 7 years for people who are refugees. We don't know that information in this example, but I could have just for our purposes, we will assume that he has not reached that 7-year limit yet. That would further restrict his eligibility. Okay, so in this case, he's not eligible for Medicaid. He's not eligible for premium tax credits. Gina has had LPR status for 2 years. Her income is at 90% of the federal poverty level. She's eligible for marketplace enrollment with PTCs, with premium tax credits, based off of having a lawfully present immigration status, but being ineligible for Medicaid due to her immigration status. Okay, next slide, please. So there's also some important things to think about for older adults who are immigrants who are not eligible for premium-free Medicare Part A, who may also be eligible for enrollment in the marketplace plans with premium tax credits and cost sharing reductions oftentimes, depending on what their income is. So to qualify for premium-free Medicare Part A, individuals must have met an applicable work history requirement. There we go again, right? Talking about the Social Security quarters of earnings. So quarters of earnings are earned by paying Social Security and Medicare payroll taxes. And this is for people working full-time, generally earn 4 quarters of earnings in a year, okay? People can get quarters of earnings based off of their own work, or in some cases, the work history of their spouse. So this sometimes is not the case. It's never going to be the case that for some older adults that immigrate to the US well into past their time that they're going to be working, right? So if they are not going to get to that point where they're going to be eligible for premium free Medicare Part A, one potential option is for them to get coverage in the marketplace. Now, I say that, but it's kind of important to note that that people really do that do plan on enrolling in Medicare at some point in their life, that they pay close attention to deadlines because there's really steep fees associated with not enrolling by certain deadlines, and those fees are permanent, on your premiums. So this is tricky. It's worth it to also reach out to some of the experts in Medicare eligibility and that help people figure out what the best options are for them. People of any age who are claimed as dependents on their taxes cannot apply for premium tax credits individually. The tax filer who claims them must also claim the premium tax credits on their behalf in the application. So just note those two things. Next slide, please. I think I'm over time, so I'm gonna just go through this very quickly. Lynn is 74 and he lives with his daughter May and has a grandson Michael. In this example, Lynn has lawful permanent resident status for 4 years. He's never worked in the US, is not planning on working in the US. He receives $2,500 a year from a pension for work completed abroad. He's not enrolled in Medicare Part A. May provides more than 50% of Lynn's support. And she claims Lynn and Michael as tax dependents and has household income at 200% of the federal poverty line. So Lynn is eligible for marketplace coverage. Lynn is eligible to enroll in a marketplace plan with subsidies, even though he's over 65. He's not eligible for premium-free Medicare Part A based off of his work history. Next slide, please. If a person can be claimed as a tax dependent, they must indicate that when they're applying for the premium tax credit on healthcare.gov. So can Lynn apply on his own? That's a question I get asked oftentimes. And no. If Lynn qualifies as May's dependent, then in this case, Lynn lives with May. He's also her relative. May pays for more than half of his support. Lynn's gross income is less than $5,050. Lynn is May's tax dependent, so he cannot apply for premium tax credits as a household of one. He may be eligible for premium tax credits, but he must include May and her income on his application for healthcare for health coverage. And it's important to note that if Lynn receives a premium tax credit, May must file a tax return and reconcile the premium tax credit on her tax return. Next slide, please. Also important to note that there is state residency requirements for eligibility for Medicaid and CHIP and Marketplace. They resemble each other quite a bit. It's when an individual intends to reside, including without a fixed address, and or has entered with a job commitment or seeking employment, whether or not they're currently employed. Next slide, please. I know I'm running out of time, so I'm going to try and fly through these. Next slide, please. Oh, sorry, one slide back, sorry. Just important to note that there are some restrictions on PTC eligibility that are important to keep in mind as you're helping people who are immigrants. Remembering that people, in order to qualify for premium tax credits, if they're married, they must file jointly with their spouse, their federal taxes. And there are certain people who are immigrants who have to file their taxes using a 1040 non-resident NR form. And some people who have non-immigrant visas, oftentimes are student visa holders, which are F visas, or people with J or M or Q visas. They must file taxes using that 1040 NR because they can't meet a substantial presence test in their first 5 years in the US. And that form does not allow most people who are married to file their taxes jointly. So it's kind of important to note that when you're helping people in those circumstances, because you don't want them to get surprised later on when they're trying to reconcile a tax credit. Next slide, please. And that is it for me. Sorry, I went over, Sonia, for a couple minutes. We do have some resources here, and as I mentioned, we have some webinars that might be relevant to you if you want to dig in deeper, and a webinar coming up next week on data matching issues. Thanks, Sonia.
Thank you so much, Shelby. I was about to get on, say 2-minute warning. But you caught yourself. So I appreciate that. Thank you so much. I'm trying to see if there's any questions. And I'm going to ask for Lynn to help me with that. I know that there's been some in the chat that have been answered.
Yeah, thank you so much, Sonia. We've gotten some of the questions in the chat answered. Really quick one for you, Shelby, just to confirm. People with B visas, so visitor visas, are generally not eligible for Medicaid or marketplace health insurance. Is that right?
Correct.
Yeah.
And
Okay.
it would be based off, it's not an immigration eligibility requirement that
Hmm.
would stop them. It's the residency requirement
Right.
that would stop.
Gotcha. And then we have one question that we'll actually just provide a link to this, I think, about explaining the 7-year limit again for folks who only qualify for Medicaid for that chunk of time. But I think also for that question asker, if you can also go back to these slides and to the recording later on. So just for the sake of time, I'm going to skip over that one and just head on straight to the next one, which is if a family has undocumented family members in their household, do we leave those undocumented household members off of their HHS and marketplace applications?
So no, they would still, if there would otherwise have to be on the application, then they would be listed on the application to the extent they have income that is associated and is relevant to the to make the correct eligibility determination for the other individual. So let's say dad's income is relevant for their child's income, right? Maybe dad's the tax filer as well.
Yeah.
They would be on the application, but there's an opportunity to identify whether or not somebody's an applicant or a non-applicant within the application, and that individual would be a non-applicant. So therefore, that person will have to answer some questions like their income, but they would not have to answer questions about their citizenship or immigration status.
Right. Gotcha. And then we have a follow-up question for the B visas. And well, anyway, you get to it, Shelby. Just are B visa holders eligible for emergency Medicaid, which they would, which the state would provide because they're ineligible for Medicaid proper or for marketplace coverage due to their residency status, not to their immigration status.
It's still going to come down to how the state implements the residency status.
Okay, so we'll follow up on the residency status question. And then another one is Texas Health and Human Services requiring qualified immigrants who entered the US prior to 1996 to August 22nd to meet the requirements of being military personnel, a spouse, a dependent, having received SSI Medicaid, to qualify for Medicaid and CHIP. I'm sorry, that was a long question. I think it might be copied off of like a code or something too.
Yeah, I'm not sure I'm following the question. I apologize.
No, that's okay. Trudy, do you want to unmute yourself and ask that question? Let me see if I can get to that. I just gave you permission to open up your microphone, Trudy.
Hi, thank you all. Yeah, so the reason I'm asking this question is because these requirements appear on Texas Health and Human Services website, but the National Immigration Law Center has concluded that based on their reading the statute, these shouldn't apply. It seems like there's maybe some conflicting information even between different state agencies about what requirements are applied to qualified immigrants who entered before welfare reform. And so I'm just wondering if you guys have any insight into how this group is being treated and which requirements are being placed on them.
So I'm sorry that I can't see the chat, Trudy. So I don't know which groups, and I know that Lynn read them off a little bit, but I wasn't. I just got kind of confused. So can you read it to me again? The groups?
Yeah, no worries. So these are qualified immigrants. We're talking about refugees, asylees, people with deportation withheld, et cetera. And so if they entered before August 22nd, 1996, are they subject to meeting the following requirements to be eligible for Medicaid or CHIP? On the HHS website, it talks about certain military personnel and their spouses or dependents, folks who were receiving SSI on August 22nd, 1996, and have lawfully resided in the US on or before that date, or folks who have the 40 qualifying quarters of work.
So all of those folks, if they were here before the welfare law was implemented on August 22nd, 1996, the question is, right now, Texas seems to be only allowing people within those groups, and they're applying the 40-quarter requirement, even if they were here before August 22nd, 1996. Am I hearing you correctly?
Yeah, I'm wondering whether they're being subjected to that or not, because the information on the HHS website said that they would have to receive that, but elsewhere in the
Mhm.
statute and policy manuals, it seems like that might not be the case.
Yeah.
So I'm just wondering if
Well,
there's.
Trudy, you know what I think is that maybe you and me can touch base like
Sure.
offline, that just investigate a little bit further what exactly is happening. And if there is something that Texas is, and by the way, it would not be the first time. Sorry, that a state, I'm not just gonna say Texas, but that a state has not implemented the rules accurately. They're confusing rules, so I'm gonna assume good intentions, but sometimes there are mistakes that are happening, and there's an opportunity to intervene. So, but I don't know, figuring it out during this webinar is probably the best, but you and I should touch base offline, and we can bring in our friends at NILC as well that we work very closely with, and see if there is something that Texas is doing to exclude people where they should not, then we should try to see if there's something we can do to intervene.
Sounds good. Thanks so much.
Thank you, Trudy.
Thank you all so much for those questions. And of course, the slides will be available. So here is Shelby's contact information. Thank you again so much, Shelby, for spending some of your time this morning to go over this very important topic. I'd like to also now pass it over to Karen. Thank you for being patient, Karen. Go ahead and take it away.
Hi, good morning. Before I begin, I want to thank Lynn and Sonia for the kind invitation to present today. I am thrilled and honored to be a part of this state conference, and I am truly excited to contribute to the important discussions around immigration resources available. I look forward to sharing insights from my experience and learning from the incredible lineup and speakers and participants. Today I'll be presenting on how to identify and access resources for undocumented immigrants. I will share some resources available, as well as some guidance on how to find resources in your region. So next slide. Knowledge is key. It is very important to be familiar and understand the challenges undocumented immigrants face when accessing community resources. So not too long ago, a man stopped me out in the street. I was wearing my MHP Salud shirt, right? My uniform. And he asked me, "You help with health coverage, right?" Our conversation was in Spanish, but I did notice he used words differently than my normal Spanish. He told me someone had recently signed him up for coverage through Obama insurance, to which I said, "Marketplace." He is an undocumented immigrant and does not have income. So I educated him on what that meant, and whoever signed him up needed to stop his coverage, immediately. He then shared that he was desperate to find dental services available for him. He told me that he had broken one of his teeth while playing with a bottle cap. While allowing him the opportunity to share with me, I was thinking of places where I could refer him to. Resources came flooding in my mind, right? And then I started thinking, yes, this one, no. So I ended up referring him to the United Medical Centers, which is a local federally qualified health center. I will slow down. Sorry, I see it. Okay, I'm going too fast. Okay. So I referred him to the United Medical Centers because they have a dentist there that could help him. But I didn't stop there. We have a local organization, Mission Border Hope, that assists with clothing and food as long as a name is provided, no ID, no address, nothing else is requested from the person seeking assistance. I also provided my navigator's information as well as my own in case he needed more resources in the future. And that's when I realized I had to add a tab with resources available to my resource directory for the regions that I oversee. In this tab, I should include undocumented immigrants resources so that I can refer community members to the services accordingly and they can receive the assistance that they need. So us as community health workers, as navigators, we're familiar with many of the resources available, and we often think people are too. Sometimes we expect our consumers to ask us about the services they need, and some do, but it is more important about us making ourselves approachable and building a safe space without judgment so they can feel comfortable sharing their needs. Once we have the information about the needs of the individuals and families, we can provide them with the right resources to meet their needs. So when helping undocumented immigrants, it is very important to have knowledge on healthcare, legal aid, housing, and education resources available to them. Next page. So federally qualified health centers provide low cost or free healthcare regardless of immigration status. There are 70 FQHCs in Texas operating more than 650 service delivery sites across the state. Services offered through FQHCs include primary care, behavioral health, dental services, pharmacy services, lab and diagnostic services, specialty referrals, chronic disease management, health education and outreach, supportive services, telehealth, and more. These services are offered on a sliding fee scale based on income and are designed to ensure that even uninsured, low income, and undocumented immigrant patients have access to affordable care. Some examples include El Centro de Corazón in Houston and Community Care in San Antonio. We also have nonprofit organizations such as Raíces and Texas Association of Community Health Centers that offer medical services. Next page, please. When undocumented immigrants have an emergency rooms are required by law to provide medical treatment regardless of immigration status. We also have community centers like Integral Care in Austin or the Harris Center in Houston, which offer mental health services for low-income individuals. Next page. It is important to be knowledgeable about legal and social support. And groups like Raíces or American Gateways offer legal services for immigration matters, which often include help with health care access. We also have the community health workers and navigators that can connect undocumented individuals to local healthcare resources. In additional support services, I included the food and shelter as well as educational resources. So local churches and shelters often provide food, clothing, and temporary housing support. Caritas of Austin and Catholic Charities are an example. And like the one I mentioned, Mission Border Hope, that is one of the resources that we have here in my region. Public schools and many colleges accept undocumented students too. And programs like DACA also offer support. So how to access these resources, right? Immigrant advocacy organizations are everywhere. So most cities have community resource centers or immigrants' rights groups with resource guides for undocumented individuals. You can also assist health fairs and community events. So networking at fairs and events is often a helpful way to become familiar with other programs in the region. You can join coalitions or find coalitions in your area that focus on assisting immigrants so you can become more familiar with the services available in your area. You can contact community health workers, nonprofit organizations, or legal aid organizations for referrals to healthcare providers and other services. And you can also visit consulados, which translates to consulates, They offer a range of services that protect immigrants' rights, provide assistance, and facilitate integration into the community. And I added an example from a Mexican consulate in the United States, which established Ventanilla de Salud, VDS, to provide vital health information and services to the immigrant population. Key functions of Ventanilla de Salud include health information and education, health screenings and referrals, health insurance assistance, cultural and language competence, partnerships with local healthcare organizations, promoting preventative healthcare and mental health support. So the key takeaway is while challenges exist, many resources are available to support the health and well-being of undocumented immigrants in Texas. And in this page, I added resources that are available in Texas and some of the examples I added to my presentation. I think these resources are going to be available, am I correct, Lynn?
Yeah, that's right. They'll be on the Every Texan website. Thanks, Karen.
Thank you. So if you go to the Find an FQHC or LAL site near you, you can enter your zip code and find a federally qualified health center near you where you can refer people with either low income or undocumented immigration status. El Centro de Corazón de Houston, Community Care San Antonio, Raíces, Texas Association of Community Centers. So I made sure to add everything that was centered in Texas so that you can have some options if you're close by. So next page. Here are more resources on mental health, legal and social support, and food and shelter. And before I end my presentation, I would like to share about an application that I came across yesterday. This is very quick, but I'll say it really slow. So this application is called CHW Connector, which stands for Community Health Worker, and you can download it on Apple or Android devices. It is a new application for community health workers to connect nationwide. It is fairly new, but I do see a lot of potential in this application to connect the CHWs all over the United States and that are serving our communities. This is my last slide. Thank you so much. If anybody has questions, I'm here. I believe my information will also be shared on the
Yeah,
web.
it sure will. Thanks, Karen.
Thank you.
Yeah, and we do have one really specific and really good question that probably a lot of folks have had before, and I think is worth just kind of like revisiting.
Yeah.
What advice would you give to an undocumented parent who's looking for autism support services for a child who is a citizen?
So for a child who is a citizen, first off, they can apply for services like Medicaid and Marketplace, depending on what they qualify, because the child is a citizen. But if they don't feel comfortable, going to a regular clinic, I would suggest going to a federally qualified health clinic, which they can refer them to the specialist that they would need to visit or that could further assist them.
Mm-hmm.
They
Gotcha. So
also
like,
have community health
yeah,
workers at these clinics. So community health workers do a lot of great work and wonderful work for the community, and they provide other resources. So I think that would be the place I would send them.
gotcha. Yeah, that's really good advice. Thank you so much, Karen.
We're also getting
And
some questions about the app that you just mentioned. Is that something that is that something you download from the App Store or, Google
Yes.
Store?
So I
What's the name of
downloaded,
it?
I'm sorry,
What's the name of it, or how do you find it?
it's called CHW Connector. That's what it's called. It's CHW Connector. I went to the app on my Apple phone and I downloaded it. So it asks you to create an account with an email, and then it'll ask you if you're a community health worker. So in that app, let me get my phone and I'll tell you the options that it gives you. It gives you different options. Like I mentioned, it's fairly new. So I'm thinking that it's going to be a wonderful resource for the CHWs, but it's just getting started, right?
Right.
See, Lisa added chwconnector.org, but it is an app.
Yes.
Um,
And I just want to make sure that people can find it if they want to do that, download that on their phone.
I
Thank
will
you so
send it
much.
to you. Yes, I
Yes.
will send it to you so you can add it on the web
Right.
links.
Yes, on the links that we're sharing. Does,
Yeah.
Lynn, is there any more other questions that you're seeing that maybe I didn't see because I'm running the slides? It's kind of hard to check the chat and
That's
the,
okay. Yeah, there are more questions, but we will follow up with Kadem afterwards and send them out in our Q&A report,
great.
just because of time. So we want to try to give interpreters a break between now and our 10:30 session,
Yes, ma'am.
which we will be super stoked for everybody to join for. Go ahead, Sonia.
No, absolutely. I was just gonna say if we want to go ahead and go ahead and do the I'm gonna stop sharing so we could do the raffle and the poll
Mm-hmm.
and we can wrap up this session.
Awesome. So yeah, the
Thank you.
poll I just launched for everybody. You should see it in your Zoom screen here. If you are in the lobby chat, you will not see the poll that we just launched. So don't worry about that if you're in the lobby. Laura, I see that you raised your hand and it looks like put it down. So I'm going to share my screen now and we will launch this raffle prize here at the end of the session. And this is our second to last session, y'all. It's been such a good conference. Don't miss the next one. It is going to be an assister roundtable. We will start with a little overview of the resumption of the failure to reconcile process that's gonna restart again before 2025 open enrollment. So failure to reconcile blocks that prevent people from having APTC when they're enrolling during the open enrollment period. The IRS is going to start redoing those checks this year, which will prevent people again from having APTC before they get to 2025 coverage, unless they filed their taxes or unless they remembered to file their 8962 if they had marketplace coverage for the past 2 years. So we'll talk about that in a little bit more detail ahead of our next panel at 10:30, which will be with a bunch of assisters. It'll be a roundtable, no presentations, open conversation. It'll be fantastic. And here at the end of this one, I will share my screen so we can raffle away. Okay. I did, in case anyone's concerned, I did add all of the 63 or 73 people who registered for this conference between yesterday and today. So all of your names are added into this list. I also did remove everyone who got gift cards yesterday, and congratulations to all of our raffle winners from yesterday. And now I'm just going to spin and we'll see whose name we pop up with here.
While you're doing that, just want to thank our speakers again, Shelby and Karem. Thank you for sharing your insights and your expertise with us today. Naomi Martinez is our
Let's
winner.
see.
Is she in the house?
I'm checking the lobby chat and don't see Naomi, and now I'll check our chat here. And Naomi, if you are here, if you raise your hand. Oh yeah, Noemi is here. Okay, cool. So we have one winner, Noemi
Great.
Rodriguez. Congratulations. And I'm going to remove you from this list now, and we will do one more gift card winner before the end of this panel. Rafael Diaz. Let's see, I'm checking the lobby chat first. I don't see Rafael in there. Let me check here. Oh, it looks like Rafael missed this panel. Okay, well, that's all right. I'll keep checking the lobby chat too to see if Rafael pops up there. But I'll close for now and spend one more time. All right, and we are landing on Eric Rivera. Let's see here. All right, Eric is in the room. Fantastic. Well,
Congratulations.
congratulations, Eric. Yeah, congratulations, Noemi. We'll send you guys virtual gift cards. And yeah, Sonia, why don't you lead us out?
Oh, no, just thank you. You already did the reminder for the next session. We'll see you guys very shortly. Thank you all.